Thank you everybody for coming today. My name is Khris Erickson. I'm a certified professional dog trainer knowledge assessed, and I'm also a certified separation anxiety pro trainer. So when we talk about separation anxiety, we have to determine whether the dog is actually suffering from it or not. So the typical definition is if the dog is displaying behaviors that could be triggered by anxiety and they only occur when the owner isn't there, or they're more intense when the owner isn't there. And all the list that I've got here are behaviors that owners typically notice that tells them that their dog has a problem. So the dog isn't going to necessarily show all of these, display all of these behaviors, but they're going to display at least a couple of them. And the other thing about it is these are what I think of as being big behaviors. I'm going to talk a little bit later about some of the more subtle behaviors that I see as a dog trainer. Separation anxiety is classified as a phobia. So it's typically a panic disorder, and a phobia by definition is an irrational fear. In this case with separation anxiety, the dog has a fear of being left home alone without their owner. So it's really important to realize that the behaviors that the dog is exhibiting are a symptom of the separation anxiety. When an owner comes to me and says, you know, my dog is barking nonstop, the neighbors are complaining, how do I get my dog to stop barking? Your problem is not the barking, the problem is the separation anxiety. So we can't really get rid of the symptoms of the separation anxiety unless we get rid of the anxiety itself. So there's two different categories of separation anxiety. The first one is the one that is a lot more common. That's where the dog is panicking when they're left home alone without their owners. So if there's other humans in the house, the dog would be okay. But if there aren't any people there, that's when the dog panics. In most cases with separation anxiety, the presence of other animals in the house does not really make a difference. It's about the humans. In very small amount of cases, another dog or a cat can make a difference, but that is not the norm, that is the exception to the rule. And then the other form is a little bit more tricky to work with. That's what we call hyperattachment, where the dog is attached to one person, sometimes two people. And so when their person leaves, the dog will panic even if there are other people still in the house. With that one, the first thing we need to do is something called spread the love. We're going to try and get the dog bonded to other people in the home. So the person the dog is hyper-attached to would back off on the attention that the dog is receiving and let other people take over some of the more fun stuff, like taking the dog for walks, feeding the dog, giving the dog treats, playing with them. Try to get that dog to form an attachment. And then the other thing that can be really helpful too is getting the dog to be attached to somebody outside the home, like a dog sitter. And the reason we want to do this is if the dog is left without their person and they're panicking, that's just a really bad state of affairs for the dog to be in. And if we can get them attached to other people, at least the owners have that option of trying to make sure the dog is not in that state of panic by leaving them with other people. So when we look at phobias and panic attacks, we have to think about what's going on in the brain. I'm not a neurologist, but this is my understanding about what happens with a phobia. So the dog is paying attention to what the owner's doing. They know that the owner's preparing to leave, so they know that certain behaviors are going to indicate the dog is going to be left home alone. The dog's brain says, you are in severe danger, and at that point, the body gets flooded with cortisol and adrenaline. The dog goes into fight or flight mode and desperately tries to escape. That's why dogs are destructive when they have separation anxiety, because they're trying to get out. So a dog who is crated and has separation anxiety will frantically try to get out of the crate. A dog who's loose in the house is frantically trying to get out of the house either through the doors or the windows. When they're in that state, they're not rational. They're not thinking straight. So even if the dog is trained really, really well not to chew on things, they can't help themselves. And sometimes dogs will also go into kind of a freeze response. I have a really good video of this a little bit later on. We are not advancing. Oh, I'm not sure what happened. Okay. So again, we have to be very specific about what is and isn't separation anxiety. So Just because the dog is having accidents in the house when the owner isn't there doesn't necessarily mean that it is separation anxiety. It could be that the dog is house trained when the owner is there, but isn't house trained when the owner leaves. So this can happen where when the owner is there, the dog knows that if I give a signal, they'll let me out. The owners are paying attention to those signals. The dog gets frequent opportunities to relieve themselves outside, but then the dog literally doesn't know that they're supposed to hold it if they're home alone. Young dogs that are given too much freedom. I see this one a lot. Somebody says, well, I have an 11-month-old dog. He hasn't chewed on anything in the house for a couple of months. I'm going to go to work and just leave him loose because I don't like to leave him in a crate. And then they come home and the dog had a lot of fun. So I always say that's like saying, my 14-year-old kid is really mature and responsible. I'm going to leave him home alone for the weekend. And then you come back and you're kind of surprised that your house doesn't look the same as when you left it. Okay, a dog who doesn't get enough exercise and enrichment. So just like kids, dogs who are bored and have too much energy, they're going to find something to do, and it's probably not going to be something that you want them to do. So this is a good example of this. So this is not a dog with separation anxiety. The dog is obviously very destructive. But this is a dog having what a friend of mine calls separation anxiety, or separation fun, not separation anxiety. That's something I want to come home to. Okay, another thing is a dog who barks a lot at home. So if somebody gets the comment from neighbors, like your dog barks a lot when you're not home, that isn't always separation anxiety. It could be a dog who's just really sensitive to things that are happening outside of the home. So if they're looking out the window and they see passerbys, or if they're hearing noises, maybe they just bark quite a bit. So we have to be careful that we're not automatically saying it's separation anxiety because the dog barks a lot. Dogs who are anxious about other things. So this isn't 100% true, but in many cases, if the dog is selectively anxious when the owner is gone, we have to think about what else is going on in the environment. Is the dog only anxious when there's a thunderstorm moving in, or is the dog anxious because there's construction going on nearby? We have to think, is it truly separation anxiety, or could it be caused by something in the environment? Confinement anxiety is one that a lot of people mistake for separation anxiety. There are dogs who do not do well crated, and there are dogs who do not well when they're confined to an exercise pen, but they do just fine when they're loose in the house. This is Olive. She was a client of mine that contacted me because she would literally cry the entire time she was in an exercise pen. Okay, so I did an assessment. She was loose for 5 minutes, and this is actually running video. That's what Olive did for 5 minutes. So we determined it was not separation anxiety, it was more of a confinement anxiety issue. And then there are medical issues that can look a lot like separation anxiety. So if there's a sudden onset, I would always recommend somebody goes to see the veterinarian and make sure it's not something like canine cognitive disorder, which is dementia that geriatric dogs can get. Medical incontinence could cause accidents when the owner isn't home. Pain issues can cause some problems that look a lot like separation anxiety as well. Okay. We're not 100% sure what causes separation anxiety. We do know that with people, when somebody has an anxiety disorder, it's almost always because there's a family history of it. So there's a very strong genetic correlation to it. We have no reason to think that it wouldn't be that with dogs. And often with anxiety disorders, there's a genetic predisposition to it, but there's something in the environment that triggers it. There's a lot of research on mammals with development. So if the mom dog is pregnant and she's in a stressful situation, all those stress hormones are being absorbed by the puppies, and it impacts brain development of the puppies. And we know that puppies that are in that situation are more likely to be anxious as adults. We also know that when puppies are first born, if they're in a stressful environment, it also makes them more predisposed to being anxious as adults. We saw this a lot in COVID, where the dog was literally never left home alone because there was somebody home 24/7, everybody was working from home, and then people get called back to work, and that's when it triggers the separation anxiety. So the dog just never learned the coping skills to be left home alone and be comfortable with it. Traumatic experiences can cause separation anxiety. I talked to another trainer, and she said that there was a tree that fell on the house when the dog was home alone, and they know that triggered the separation anxiety in that particular dog. It could also be something that happens and you're not aware that it happened when you were gone. So if there's road construction and they don't start the construction until you've left for work, and then when you come home, the construction's done, that might be very, very triggering for a dog, and the dog might associate being in danger when you're not there. This is a common trigger for separation anxiety where the dog has another canine companion or a human, and that person either passes away or maybe in the case of divorce or something moves out of the house, or another pet in the home gets rehomed, and the dog is stressed, and that triggers the separation anxiety. And then change in environment or routine. We see a lot of dogs in rescue and shelters that have separation anxiety. It could be that those dogs, because they've been rehomed several times, are triggered by separation anxiety because the uncertainty of their experience. You can also see it in somebody who moves and doesn't acclimate their dog to the new house before they leave. And so the dog is left in what they consider a strange place, and their owner isn't there. So just because we move and we know it's our new home doesn't mean that the dog knows it's the new home too. Unfortunately, there is a lot of bad information on the internet, including with separation anxiety. So I see this one a lot, crate the dog, and I think the reason people say this is that a dog who has separation anxiety often is destructive, and they feel like if the dog is crated, the dog cannot be destructive, and the dog cannot hurt itself. Some dogs will actually injure themselves trying to get out. And so crating the dog would seem to be a good solution for that. The problem is that crating the dog does not alleviate the anxiety. So you now have a dog that is confined in a very small space, and the dog is still anxious. So it doesn't resolve the anxiety, it just keeps the dog from being destructive. But the other problem is that with some crates, the dog can actually destroy the crate from the inside trying to get out, or they can hurt themselves trying to get out. It's another one I see a lot. I have quite a few clients that have multiple dogs, and their dog still has separation anxiety, so I would not recommend that anybody get a second dog just to alleviate their dog's separation anxiety. If somebody wants a second dog, that's great, but if you get a second dog, you might end up with two dogs, and one of the dogs still has separation anxiety. This sounds like it should be a good idea. Give your dog a lot more exercise, because if your dog is tired, how destructive and how much barking can they do? But one of the stress hormones is adrenaline. So if you're tired, you get hit by adrenaline, you're not tired anymore. Another common one, play music or turn on the TV. This typically does not make a difference. The other problem with this is that this can actually be a trigger for anxiety. So the dog sees that you turn on the TV and then you leave, and now they start to get anxious anytime you turn on the TV. The same thing can happen with food stuffed toys. If every time you leave, you go to the freezer and pull out a Kong that's been stuffed with food, the dog starts to get anxious when they see the Kong. The other problem with that is that many dogs with separation anxiety don't want to eat when their owners leave. So that's not going to help the dog at all. This one kind of makes me laugh. Dogs have extremely good noses. Our whole houses smell like us. Anywhere you sit or walk smells like you. So putting a sweaty t-shirt down is not going to make your dog feel more comfortable because they can go anywhere in the house and smell you. I talked to somebody who left her dog home alone for 5 hours and watched her dog on camera. The dog vocalized for the entire 5 hours, so letting him cry it out is not going to be effective. And then this is interesting. I see this a lot too. Ignore your dog before you leave. Ignore your dog when you get home. There's actually, it was a pilot project. It was a pilot study of 10 dogs. those dogs did not have separation anxiety, but they split them up so that in one occasion, the owner gave the dog 1 minute of petting and attention and then handed the dog off with a stranger, and then the owner left for 3 minutes. And then the other time, the dog was ignored for a minute and then handed off to the stranger, and the owner left for 3 minutes. And the dogs who got the attention and the petting actually showed less stress signals and a slower heart rate than the dogs that were ignored. Anecdotally, I've had 2 clients where this kind of backfired. In one case, I was watching the dog as the owner was doing departure exercises, and she would come back in the door, she'd walk right past the dog like he didn't exist, and every time she did this, I could see the dog getting more and more stressed. And I told her, you need to at least acknowledge the dog and pet him a little bit before you go sit down on the couch. And we saw a reduction in his stress at that point. And then I have another client who, she was acknowledging her dog and she was petting just a little bit, but then she'd go off and do something else. And that dog's tail, which normally was curled right up over the back, had started to drop every time she did this. I said, you know, let's give Oakley a little bit more attention. And she sat on the floor and she was petting Oakley, and then she left. And after a couple of repetitions, Oakley was laying on the floor and didn't even get up when she walked out the door. So I've had 2 clients where ignoring them would have made things a lot worse. And then leaving for 5 minutes and then returning. This is kind of in the right ballpark as far as what we do, but 5 minutes is way too long. If you are in a panic state and you leave for 5 minutes, that is an eternity to a dog. So we don't leave for 5 minutes and come back. We leave for a lot shorter time. So I talked a lot about what doesn't work to resolve separation anxiety. So now I'm getting to the point where we talk about what does work. We use something called systematic desensitization. It's also referred to as exposure therapy. Psychologists use this with their patients that have phobias. And with desensitization, what we do is we determine at what point the dog starts to display anxiety behaviors, and we start the absences or the departure routine earlier than that. So we try to make sure that the dog doesn't experience any anxiety during that departure routine. A lot of trainers, when they're working with behavior issues, in addition to desensitization, also use something called counter conditioning. So if I have a dog who is afraid of thunder, and thunder goes off, what I might do is start giving my dog toys, playtime with toys, or I might grab some treats and give my dog treats. So they hear the thunder, get the toy out, play. Another blast of thunder goes off, give them a couple of treats. And over time, the dog will start to go, oh, I heard thunder. Okay, I like hearing thunder because I'm getting food. So that's counter conditioning. You're changing the dog's emotion by giving them something that they love. We actually do not use counter conditioning for separation anxiety. There was a study that did counter conditioning and desensitization with a group of dogs. And then with the other group of dogs just had desensitization and no counter conditioning. So what they found was the group of dogs that got food along with desensitization when the owner left did just as well as the group that got desensitization and no food. So we don't use food in training partly because the research says it's not necessary. The conclusion of that particular study was that the important part of the treatment plan was desensitization. The food was not relevant. The other reason is, I mentioned this earlier, a lot of dogs are not going to eat when they're anxious and the owner leaves, so there's no impact from the counter conditioning. I mentioned this earlier too, the food predicts that the owner is about to leave. They go to the freezer, get that Kong out, dog says, oh, they're leaving. And food can actually give us a false reading. So if I give my dog a food stuffed Kong, and some dogs with separation anxiety will eat when the owners walk out, and I'm watching the dog on camera, I don't know if that dog is anxious and it's just covering up the anxiety by the dog eating, kind of like if I'm stressed and I come home and I eat, a couple of pints of ice cream, the stress comes back as soon as I finish that ice cream. So we don't know if that's happening with the dog or if the food is actually making the dog feel less anxious. So it's really hard to treat a dog if we don't know specifically what's going on. Food can help as a management tool. So I'll talk in more detail about this, but ideally we would not leave the dog home alone while we're doing the training. But let's say there's an emergency situation, you have to leave for a short amount of time. You know that if your dog works on a Kong, he's good for 20 minutes, and you just need to run out real quick for 20 minutes to go get something. You could give your dog that foodstuff Kong to alleviate some of the anxiety, so at least the dog isn't feeling the full extent of it. We don't want to do this too often, though. I would not recommend that somebody makes a practice of this, because eventually it could backfire and the dog could start seeing that foodstuff Kong is a trigger for the anxiety. But if it's like in a pinch, you need to do something to alleviate the anxiety for that one situation, that might be a solution for that. I do all of my consultations with my clients remotely over Zoom. And the reason is I need to assess the dog and observe the dog when the owner isn't there. And I can't really do that from the couch. So if I can watch the dog remotely by camera, it gives me a better sense of what is actually going on with the dog. I have the owner set up the camera so that the dog will be visible when they approach the doorway. And usually it's going to be on the doorway, because that's where most dogs with separation anxiety are going to go when the owner walks towards the door. I don't want the dogs confined to a crate, so even if the owner is really set on crating their dog when they leave, I'll talk about, we can work on that later, but right now I just need to know if the dog has separation anxiety or if it's got confinement issues. So I want the dog to be loose when I do the assessment. Some dogs will become anxious before the owner actually leaves. So I have the owner do a series of things, like if you approach the door, if you touch the door, at what point do I see anxiety signals? I'm watching the dog's body language the whole time. And as soon as I see any signs of anxiety, and what I'm looking for are really subtle signals, I end the assessment, because I don't need to see the dog in full-blown panic attack. I just need to know at what point is the anxiety being triggered. So these are the types of subtle signals that I'm looking for. Yawning, lip licking, excessive sniffing, any vocalizations. I'm going to end the assessment. And then at that point, I talk to the client about what our starting point is and what the process is for training. And we come up with a game plan for the dog. So the assessment tells me when does that anxiety trigger. It gives me a starting point. If the dog is triggered by anxiety from just the owner touching the door or even opening the door but not stepping out, that tells me we have to start before that. So there's an exercise called Door is a Bore, where we literally want the dog to be bored by the owner walking to the door. And there's 10 steps with that. So my starting point as far as the 10 steps will depend at what point the dog exhibits anxiety. So with one client I have right now, and she's out the door, but we started with her just touching the doorknob and then turning and coming back into the house. And then we progress all the way out the door. If the dog is good until the door closes behind the owner, then I'm going to start with the door closing behind the owner. And the starting point for most of those dogs are 10 to 15 seconds. So when somebody says, leave your dog for 5 minutes, that's way down the road. That's not going to be our starting point. I've never had a client go longer than a starting point of a minute. Our goal with these training exercises are to make sure that the dog doesn't have any anxiety from the time the owner starts the training exercise to the time the owner finishes the training exercise. The goal is to make the dog feel safe when the owner leaves. The owner's goal is to gain time so that they can go run errands or go to work. And that is our ultimate goal, but we want right now, every time the dog is left home alone, for the dog to feel safe. And if the dog feels safe when you do the training exercises, by default, you're going to gain time. This is a sample training plan. So this would be a client who's already reached a point where the dog is comfortable with being left home alone for 15 seconds. I have the owners do what we call warm-up steps. So these are durations of the dog being left alone at such a low level that the dog can do it easily. So if the dog can cope with 15 seconds, 3 seconds, 7 seconds is nothing. And What happens with these warm-up steps is that the dog kind of gets into the frame of mind like, oh, we're doing departure exercises, I can do this. Some dogs love warm-up steps. They like the predictability, they like the procedure. It makes them feel more comfortable, gets them into the swing of things. Some dogs don't do well with a lot of warm-up steps or don't like warm-up steps at all. So I've got 2 clients right now that both dogs will do 3 warm-up steps, but anything more than that, it stresses them out, so I have to reduce the warm-up steps. After we do all the warm-up steps, then we do our target duration, which is the longest absence. So it's literally just walking out the door, closing it behind you, waiting 15 seconds, and coming back in. If the dog does well with that session 1, then we're going to expand it. So we went from 15 seconds to 21 seconds. So this would be a week's worth of training. And if you look at it, you're thinking, so I spent a week training the dog and I've only gained 27 seconds. So by session 5, you're at 42 seconds. I like to reframe that and tell people that you actually increase the amount of time your dog can cope with being alone by almost, 3 times the amount that you started with. So you'll make progress, but it's better to go slow and go at the dog's pace than it is to rush things. We're looking for an absence of anxiety signals. So every time my client does a training exercise, I want the dog on camera and I want the owner looking at their phone to see what the dog is doing and observe those body language signals. I also want to see loose body language. So in the early stages of training, I don't expect the dog to go lay on a dog bed and sleep. It's very abnormal for that to be the situation. What happens in the beginning stages is most dogs will follow the owner to the door and stand there and wait for them to come back. And that's fine. I just don't want to see stiff body language, and I also don't want to see anything like lip licking or whining or yawning. If the owner sees anxiety during training, I want them to immediately come back, even if it's before their target duration has completed. I want them to end the session because we don't want to continue to stress the dog. That's the opposite of what we're trying to achieve. Sometimes if you just give the dog 24 hours and try the same exercise again, you get a better result. Dogs have bad days just like we do. And then if there's 2 training sessions in a row where the owner had to come back early because the dog exhibited anxiety, then we have to go to a shorter target duration and make it easier for the dog. Going backwards is easier to go forwards than just having the dog have anxiety session after session after session. It says suspending absences. So ideally we don't want the owner to leave the dog home alone except for those training absences. With systematic desensitization, if you leave the dog home alone and they panic sometimes, but you leave the dog home alone and they are fine because you are doing training departures, what can happen is the dog starts to feel anxious because sometimes they're feeling anxiety and sometimes they don't. So it's kind of like taking 2 steps forward and then 1.5 steps back. Your progress isn't going to be quite as good. Now, a lot of people can't suspend absences. They don't have a dog who's appropriate for daycare, or they can't afford daycare, or they can't hire a dog sitter. So if somebody is in that situation, then I would want them to minimize absences as much as possible. I have a client right now, she was adamant that she had to leave her dog home alone for an hour and a half, and we talked about it. When we do the training exercises, she leaves her dog loose in her condo. But then when she had to leave, I advised her to confine the dog in the bathroom, so that looks really different. So when you feel relaxed because I'm leaving during training departures, you're loose. When you're going to panic, you're going to be confined to the bathroom. So we're going to minimize the damage from the absence by making it look really different than the training. I also really strongly recommend that people talk to their veterinarian about medication if they have to routinely leave the dog home alone. And that was the case of my client right now too. Elise Christensen is a veterinary behaviorist. She has 2 webinars that if you're interested in behavioral medication, I can highly recommend. They're called Dose of Hope Part 1, Dose of Hope Part 2. And I think if you Google animal behavior vets, you'll see that come up. So basically what she's saying is that if the dog is frequently experiencing panicking anxiety, the training isn't going to be as effective. So her recommendation is the dog be medicated so that we minimize that anxiety. So Dr. Christensen, when we can't avoid the triggers that our patients are experiencing, they have a really hard time learning new ways to respond because they're always in an anxious state or always in fight or flight or always over behaviorally and emotionally aroused. That was the quote I was trying to tell you about later. When are meds most important? So sometimes owners do not want to put their dog on medication because they perceive it as being unhealthy or dangerous. There's actually a lot of research on these anxiety medications. They are extremely safe. There's a long history of and a lot of studies on the use of anti-anxiety medication, but owners sometimes are a little bit leery about using them. But if the dog has to be left home alone, I would say that medication is mandatory. Remember that the dog is panicking from the time the owner walks out the door to the time the owner comes back. And I think that's a welfare issue. If the dog is that panic-stricken, I think that's just as much pain that the dog is experiencing as if they have an injury. If the dog is hyper-attached to one person in the household, I think medication can be really helpful in that situation because, again, we're going to try and get the dog attached to other people in the home, but medication can make that process go a little bit better. If training is going really slowly or if you hit a roadblock, that can happen with separation anxiety training where progress just isn't being made, or we made good progress, but now we're stuck at this 30-minute point and I can't get past 30 minutes. Sometimes giving the dog medication is the thing that kind of helps push you over that. So again, Dr. Christensen, our goal in general is to use medication to help our behavior modification go more rapidly, to give the patient better resiliency so they can learn new ways to respond, and so they can practice those new ways to respond. There was research that was done. I know of 2 studies. One was from a medication called Reconcile, which is dog fluoxetine. The other one was Clomicalm, which is dog clomipramine. Both are anti-anxiety medications that are routinely given to dogs with separation anxiety. And what they did in both these studies is they had a group of dogs suffering from separation anxiety. They were given anti-anxiety medication and they were given behavior modification. The other group of dogs was given a placebo and they were given behavior modification. And in both studies for both medications, what they found is that the dogs made better progress when they were on medication compared to the dogs who were just treated without medication. There's 2 different categories of anti-anxiety medication. One is what we call a daily slow-acting medication. So that would be something that would be given to the dog daily. Those build up in the system over a course of 5 to 8 weeks before they're fully effective. And then once they're fully effective, they're kind of just in the dog's system 24/7. The other one is fast-acting medications or situational medications. These are medications that are given and they kind of have a half-life of 5 to 8 hours. So if you maybe have that one situation where you have an emergency, you can give the dog the medication and then hopefully you'll be home within 5 to 8 hours and the dog will feel better because they were on that medication. So what can we do to make sure that we are going to be successful with training? If you have a dog who tends to bark at things that they see out the window or hear out the window, trying to block the dog's stimulation to those things can make a big difference for 2 reasons. First of all, our goal is for the dog to feel calm when the owner leaves. And if they're at the window barking nonstop, that's the opposite of what we're trying to achieve. But then the other reason is I've told the owners come back if you see any signs of anxiety. And then if the dog is off camera and they hear barking, they're probably going to come back early. And they may not have needed to if the dog was just barking at the guy who was walking the dog in front of the house. So putting up shades or if it's responding to noise outside of an apartment, maybe playing white noise machines, to block the auditory stimulation can be really helpful in those situations. Having a predictable leaving routine. Sometimes people with separation anxiety dogs are tempted to sneak out and hope the dog doesn't notice they've left. The problem with that is the dog's going to notice you left and then panic at that point, and now they're not going to trust you. So they're going to be more hyper vigilant, looking for any sign that you might be trying to leave. So when we do the training exercises for separation anxiety, I want my clients to tell the dog they're leaving. So they usually have a very specific cue. It could be right back. It could be see you later. I let them pick whatever's going to come off their tongue a little bit better. I noticed with my own dogs, I have a couple of cues. So if I'm going out the front door and I'm just taking something out to the car, or I'm putting the garage out, I'll say something like, I'll be back in a minute. And if I'm leaving and it's going to be a real long absence, I'll say, be good dogs. If the dogs are if the dogs are going out outside the back door, I'll say, let's go outside, and they come running. And if I'm opening the back door and the dogs aren't going anywhere, I'm just putting something in the recycling bin, then I might say, wait, so that the dogs know, don't get off the couch. We're not doing anything fun. Avoiding training after a stressful event. We're trying to alleviate and eliminate stress when you leave. So if the dog just came back from the vet and they had a very stressful vet visit, that is not a good day to train. Give the dog 24 hours to decompress from that. Really, really important for the owner to be willing to go at the dog's pace. So, everybody wants to get out the door for 2 hours so they can go, have a life. But if you push things too fast before the dog is ready, it's actually going to go a lot more slowly. So not all departures are the same. Dogs are very good at specific, predictable events. They're not so good at generalization to different events. So the person who's doing the departure training makes a difference. So if there are two people living in the household, the dog might be more successful at one departure time with one person and less successful at that same departure time for another person. So we might have to change what the training looks like depending on who's doing the departure. The door makes a difference. If you have one door that the dog has a negative association with, because that's the door the owner leaves and the dog panics when the owner leaves, but then the other door is the door that the owner takes the dog out for walks, it's going to be easier to start with the door that the dog has a good association with. I ran into this recently with a client. We tried the back door for a really long time. We'd get to a certain point and then just like everything would fall apart. The dog would start to stress out. So we switched to the front door. And she's currently up to like a minute and a half. And it went pretty quickly once we switched to the front door. The time of day can make a difference to some dogs. The weather can make a difference. And the exercise schedule. Was the dog exercised today or not? If the dog is not doing well with training, I will often ask, when was the last time the dog had exercised, because that can make a difference in the success of the training. So at some point, you're going to want to take this training that you've been doing and use it for real life. The owner is going to want to go to the store or, meet a friend for coffee. So we need to think about adding in the pre-departure activities. So one of the things I have people do is when they're getting ready to go, they do certain things that tells the dog I'm about to leave. So maybe it's pick up their purse, maybe it's pick up their keys, putting on a certain jacket that they only wear when they're leaving the dog home alone. So I have the owner drop those out because we want the departure exercises to be as anxiety-free as possible. So when they're going to stand on the other side of the door, I don't want them to pick up their keys. I don't want them to put on their jacket. I'm going to have them drop out as many of those things that might trigger the anxiety as possible. But now, once we hit 15 minutes, I want them to start adding those back in, because we have to start making those departures look as real life as possible so that they can actually functionally use the training. I'm not going to have them add all of them in. So it's not like one day it's like, okay, you're going to pick up your keys and grab your purse and put on your jacket and walk out the door. We're going to pick up the keys and then do a very short departure. If that goes well, we'll increase the departure time. And once we've got the keys set, then we'll add in the purse and all the other things. I have to think about If somebody's got an attached garage, the dog can hear the garage door going up and the car pulling out. So we're going to add that in. So if somebody's been doing departure training and they've just been standing in their garage for 15 minutes, now we're going to start adding in one part of that, that whole process at a time. So I might add in just lifting the garage door, but not anything else. And once the dog is good with just the garage door opening, then it might be opening and closing the car door and then coming back in. And then it might be lifting the garage door, opening the car door, waiting a few seconds, and then coming back in. So we're going to gradually add that whole entire sequence together until we get to the point where the dog is fine with the owner pulling out of the garage and closing the garage door behind them. If somebody lives in an apartment, I have to think about, can the dog hear the elevator and the stairwell door, and adding those things in too. So I mentioned earlier that desensitization is the way that we work on separation anxiety, but there are things that can be done that makes the separation anxiety a little bit more successful. So making sure that the dog's needs are met is really important for any kind of behavioral modification. Making sure that a dog gets enough exercise, that they get enrichment, have their natural abilities, have opportunities to be used. Scent work in particular has been proven to make a big difference with dogs that have anxiety issues. And so I oftentimes assign that to my clients. Nothing real fancy, just you're gonna find some treats that your owner's hidden around the house for you to find. If the dog is real clingy and kind of a Velcro dog, I'll have the owners work on, go to mat and relax on the mat so that you're not glued to my hip. You can lay in your bed for, half an hour, that's 5 feet away from me, and chew on your toy, and you're just fine with that. And then I also want the owner to kind of pay attention and verbally reinforce the dog for being independent. So the dog, for the first time, starts playing with the toy and doesn't need you to engage with them while they play with the toy. Verbally praising them for that can make a difference. So everybody wants to know how long it's going to take. The answer is it depends. There's a lot of variables in here that we have to think about. I had a client, she was retired. All she wanted was 2 or 3 hours so she could go do her volunteer work a couple of times a week. That's going to be really different than the owner who wants to go to work for 6, 7, 8 hours. Training schedule. Is the owner training 3 days a week? Is the owner training 5 days a week? How often their training will make a difference. How long the dog has separation anxiety. So if the separation anxiety was triggered in a puppy and the owners noticed it right away, that's going to be really different than the dog who has had it for 7 years and the owners really didn't address it until now. The anxiety experience history makes a difference too. So if we have 2 dogs, they're 2 years old, they've both had separation anxiety for 2 years, one owner almost never left their dog home alone, the other owner routinely left their dog home alone, the dog who has been left home alone is going to be a little bit harder to work with than the dog who hasn't experienced the anxiety on a regular basis. The owner's willingness to take it slow, I've brought this up a couple of times. Just understanding that this is a process, we need to go at the dog's pace, and speeding things a lot up is not going to happen. And then if the dog's on medication or not. So owner expectations are really, really important. If the owner has irrational expectations, things won't go as well. So we need to think about the fact that this whole process is going to take months. So somebody calls me and says, I have to go back to work in 3 weeks, and I need to work on this. You're not going to get to 8 hours in 3 weeks. This is a graph of a former client of mine. They started last year at the end of October, and right here, they're at 23 minutes. That is like early February. I don't know, can you see my cursor? Okay, right here. Middle of February, they got to 23 minutes. And it took 7 months for us to get to 5 hours, which was what their goal was. And I don't know if they continued after they stopped working with me. Initially, the increases will go slow. It just feels like you're not making any progress at all. So again, it took them from the end of October to the middle of February to get to 23 minutes. But then you can see it kind of goes up pretty quickly after that. And then it's normal to have bobbles or wobbles in your training where things dip off and don't go well. So in Royal's case, it went from 23 minutes down to 4 minutes because his routine changed. He went from being home with one of his owners 4 days a week and going to doggy daycare 1 day a week to going to a dog sitter's 3 days a week, like all within a week. And his training started to suffer because of it. He just wasn't making very much progress. He was struggling. He was displaying anxiety signals. So I dropped him down to 4 minutes because I needed him to be successful with these absences. But then we were able to build it up pretty quickly because then he was like, oh, okay, I remember this. I can be home alone and be fine. So if your dog doesn't have separation anxiety, what can you do to prevent it from happening? First of all, the biggest thing I see people do is they get a new puppy or they move to a new house and they just shove the dog in the crate and they walk out the door. And that's like the worst thing you can do. So taking at least a couple of days to train the dog to feel comfortable in the crate, or let's say you decide, well, I'm going to leave him loose, but he's going to be loose in the laundry room. But the dog's never spent any time in the laundry room. That can be really stressful for a lot of dogs. So spending time with the dog in the room that the dog is going to be left in and making sure that they're really comfortable and familiar with that room. So if it's the laundry room, then I want you to grab a chair and a book and get the dog something to chew on, and you're going to sit there and read a book while the dog chews on their toy for a little bit every night until the dog's like, oh, I like being in the laundry room because I get my chew toy and my person's reading their book with me. If it's going to be in a pen or a crate, I want the dog to feel really comfortable being in that pen and crate and having the owner take the time to train that. Practicing short absences so the dog gets used to the fact that you're disappearing and you're coming back. Little puppies in particular can be really helpful to just go into another room and come back and the puppy's like, oh, okay, you didn't disappear forever. And building your duration so that the dog is comfortable with you leaving and coming back. We don't give stuffed Kongs to dogs with separation anxiety as part of the treatment process, but it can be really helpful with a dog that doesn't have separation anxiety to give them something to work on when you leave. And having a predictable leaving routine. So like I said, when I leave, I'll tell my dogs either I'm going out to the car and I'll be back in 2 minutes, or I'm leaving and you guys are on your own for a couple hours. And then really, really important for any behavioral wellness, but especially if you have a behavioral issue, making sure your dog's needs are met, making sure that they get the appropriate exercise for their breed and age and personality, making sure they're getting enrichment opportunities and opportunities to use their brain. So, and then making sure that we reinforce their independence. I had a client who their marriage wasn't good, and she got the dog as her emotional support pet, and she was very clingy to the dog, and I told her he needed independence and she didn't want to do that. He's the only one who loves me, and it was kind of a codependency issue, and it didn't do the dog any favors. So we want to make sure that we're not setting up a dog to really be dependent on us for all of their emotional needs. So that is it. Here are references for some of the things that I talked about in my presentation. Well, thank you for coming.